Patients often ask, how long is the recovery period after rhinoplasty? And this is a very interesting question. The reason it's interesting is because recovery is defined differently by different people. Some patients want to know, when can I go work out in the gym again? And some patients want to know, when can I get back in the octagon and fight again? Well, there's different timelines for each portions of those recovery. So I'll just give you the general recovery timeline and let you decide which recovery question you really need answered. For the most part, pain that's associated with rhinoplasty that's significant enough to require strong medication only lasts about 3 or 4 days. The largest portion of the swelling lasts 3 days and then declines pretty rapidly after day 3, but then can continue for months after surgery. However, the pain that's associated with swelling at day 3 is usually terminated by that time, and on day 4 and 5, you can transition from the strong medicines down to Tylenol or ibuprofen. Now, when it comes to physical activity for the rhinoplasty, well, in most cases, you can return to physical activity in about 2 weeks. Now, we like you to start light at 2 weeks and then work your way up to full workouts at 4 weeks. At 6 weeks, we're okay with contact sports, so we don't want your nose in harm's way for up to 6 weeks. And you'll know if you've been to our practice or have had a rhinoplasty with us, that we have you wear your cast for 6 weeks total after surgery, at least when you're sleeping at night. So most patients will have it on the nose for about 2 weeks, 24 hours a day, and then the cast comes off at 2 weeks, and then they replace it at night for a total of 6 weeks so that we can prevent any alterations in how the nose heals in that 6-week period. After 6 weeks, the nose is pretty locked in, but the swelling is still there, and the recovery from swelling can take anywhere from 6 weeks to 3 months. Some even say 6 months to 12 months, depending on whether the rhinoplasty was extensive or revision, or a pretty simple one, which would be a lower end for that recovery. In terms of getting back to work, most patients can get back to work in 5 to 7 days if they don't mind wearing a cast on their nose. Everybody's cast and tape is all removed in about 2 to 3 weeks. So if you want to show your face and not have many people know that much has happened to the nose, you need to wait about 2 to 3 weeks before this can happen. In general, that's the general timeline of recovery. If you have any other specific questions about recovery, please feel free to hit us up and we'll get back to you.